The two most common infectious diseases in the United States are the common cold, also called upper respiratory tract infection or acute viral nasopharyngitis, and the stomach flu or viral gastroenteritis. It's not a flu, we'll talk more about that. Genuine flu tends to be much less common than stomach bugs. Now let me bust a myth here. You can't catch a cold from being in the cold. Studies show no connection between chilling and cold. That doesn't mean you shouldn't listen to your folks when they tell you to put a sweater on or a jacket or a hat when you go outside. Remember, you need a place to stay when you go home for visits. But it is a myth. You catch a cold from a cold virus. That's how you catch a cold. But some of the physical effects of breathing cold air causes your nose to send more blood to help warm it up. And that can cause some swelling and some congestion, and it can make your nose run. That's a physical reaction that can temporarily mimic the symptoms of a cold. Now, some people do have an allergic reaction to cold air, and when they're exposed to cold air, it causes the release of those histamines that are found in the mast cells, and the histamines cause those allergic reactions. Runny nose, itchy eyes, or runny eyes, itchy nose. That's the physical effects of cold air. It's not the effects of a cold virus. What causes a cold? The virus. And we have two types of cold viruses, the rhinovirus and the coronavirus. And we're going to talk about COVID-19, which is a coronavirus, but not in this context here. We will spend more time talking in class about the 2019 novel coronavirus, also known as SARS-CoV-2 or COVID-19, because it was discovered in 2019. This is the virus, the viral particle that causes COVID-19. But now let's just talk about seasonal colds. You catch a cold by being around someone who has a cold. They cough. We're all kind of familiar with these pictures right now with things blowing out all over the place. Let me just start off by saying most of the things in these pictures are water, right? Saliva, spit. It's not all viral particles. But infected people release these viral particles in their nasal secretions, in their coughs, and uninfected people can acquire this virus by touching the air that they were in or by touching contaminated surfaces, which the cold virus particle lands on. When you become infected with the cold, the virus has to come in contact with mucous membranes, also similar to COVID, the nose, the mouth, the eyes. That's why we keep them covered. And transmission with the common cold is greatest when symptoms are just beginning. What do colds do to you? Think of the video that we watched with the flu. They attack and kill the cells lining your nose and your throat. They stimulate an immune response, and that immune response causes more damage and more discomfort. Histamines are released. You have sneezing, coughing, runny nose. Kids can get a low fever, usually not adults in the common cold. COVID is something different. What are some of the complications? If a cold isn't improving, if it gets worse, it can cause a greater immune response, leading to inflammation, causing laryngitis and bronchitis. And what happens during bronchitis is that the bronchioles, those tiny tubes at the end of your lungs, you look in this picture, you have your trachea or windpipe divides into your lungs, and the tissue branches out into bronchioles. And these pathways end up in something called alveoli, we'll look at in a minute. But what happens is these can become inflamed, making it harder to breathe. And what can also happen is a secondary bacterial infection can set in, which can lead to ear infections, sinus infections, and pneumonia. What happens during pneumonia? Fluid is building up in the lungs. So a cold or the flu can make your lungs susceptible to this infection. So what's happening is that the air goes down your windpipe or trachea, through both to the bronchioles into both lungs, and those lungs end in the alveoli. If we look at this picture on the right, we see on the top normal alveoli, a cross section, they're clear, but on the bottom, these are pneumonia. It's got mucus building up, and that, well, let me switch a second. Let's look over here on the left. We look at a healthy alveolus. What we have is the blue in the middle there, which is the alveoli at the end of the bronchioles, and we have the red and blue is a capillary, the tiny, tiny diameter vessel, and it's at this level where oxygen and CO2 are exchanged. You breathe in the oxygen, you exhale the CO2. But the unhealthy alveolus, the one that's inflamed, fills up with fluid, it becomes thick, and that oxygen can't be exchanged. If you have a cold, get rest, drink lots of fluids, relieve symptoms with medications. I'll talk more about those in class if you'd like. I can post some information about medication, but it's not medical advice. What you don't do is take antibiotics. There's no cure for the common cold. Antibiotics are antibacterial. You take them for bacterial infections, but if you take them for non-bacterial reasons, you can increase the risk of antibiotic resistance. Vitamin C may be effective for colds, but supposedly only taken in large doses on the first day of symptoms. I don't have numbers for you because all the studies show different things. Something else that people take is zinc. Zinc has been shown to inhibit the rhinovirus in a test tube. Clinical trials have been disappointing. There has been some improvement in symptoms in what's called a symptom score in one study, but it was only when zinc was taken in really large amounts, more than the amount that's recommended, which can be toxic. So I'm sorry. Now, real influenza, the flu, causes fever, lasts longer, and is more debilitating than a cold. Is COVID a cold? COVID is a coronavirus, but it's acting very different. I don't have the answer to that right now, but it's not the flu. And when is the flu not a flu? COVID notwithstanding, when it's a stomach flu. In our class, you don't have to do it when you're not around me, which is all the time. You don't call it the stomach flu. The flu is influenza. It's an upper respiratory infection. The stomach flu is called viral gastroenteritis. I know, I'm sure I call it the stomach flu too, but from a science perspective, when we're talking about human health and disease, it's not a flu. It's the second most common infectious disease. If you've ever had this bug, it's not generally caused by a viral infection. It's caused by contaminated food, water. It can be passed on utensils, intestinal parasites, bacteria, but not the influenza virus. Now, there is something called the rotavirus and the norovirus that has been shown to cause viral gastroenteritis. They're extremely contagious. Stay hydrated. This is a table, well, it's a chart comparing the stomach flu, quote unquote, to influenza, and you can have a look at that. If you're going to do the assignment for this topic, I guess I should go over this because this is the first assignment. It's due a week after we're done discussing infection and immunity. You should read the 2 articles that are posted under assignments for infection and immunity, and then follow the instructions. You submit an article, you submit 2 pages or 500 words. Don't include the articles from which you are writing your assignment. I just want the 500 words. Okay? See you in class. The end.